Support for your public radio station comes from our members and from the Golisano Foundation, supporting Move to Include programming on WXXI and working with the community to lead change toward the inclusion of people with intellectual and physical disabilities. Share your thoughts at movetoinclude.org.
From WXXI News, this is Connections. I'm Evan Dawson. Our connection this hour was made on February 24th when the FDA approved a new treatment for people with Parkinson's disease. The treatment involves what experts say could be groundbreaking new technology. It's called adaptive deep brain stimulation. According to the University of California, San Francisco, the technology uses an implanted device that continuously monitors the brain for signs of Parkinson's, and if it detects symptoms, it can deliver electric pulses to keep those symptoms in check. The technology is one among several new advancements geared at helping patients. In New York, a new statewide patient registry supports research into finding a cure. As reported by the Michael J. Fox Foundation, a recent study suggests that the number of Parkinson's cases will grow by more than 25 million by 2050. That's a 112% increase from 2021. Chances are you or someone you know has been affected by this disease. And this hour, we're going to talk about what I think is pretty remarkable technology. But that is not the only story here. There have been 4 new FDA approvals in just the last year to talk about, and we're going to talk about how guests are really kind of navigating that terrain to understand their disease, to work with it, what doctors are saying, and more. Let me welcome our guests. Dr. Ruth Schneider is Associate Professor in the Department of Neurology, Movement Disorders, and the Center for Health and Technology at the University of Rochester Medical Center. Doctor, welcome. Thank you for being here.
Thank you.
And next to Dr. Schneider is Amy Jones, who is a local resident living with Parkinson's and advocate for the New York State Parkinson's Disease Registry with Rochester Women vs. Parkinson's. Welcome. Thank you for being with us.
Thank you for having me.
And welcome back to the Hyltons. Yvonne Hylton is co-founder and director of the Rochester Parkinson Network. Parkinson's Network. First diagnosed when, Yvonne?
2007.
Welcome back to the program.
Thank you.
And Kevin Hylton is here, care partner and husband to Yvonne and president and co-founder of the Rochester Parkinson's Network. Welcome. Thank you for being with us.
Thank you.
And so let me just start with Dr. Schneider, who is trying, I think, she saw how excited I was about this technology, and she just kind of wanted to not put a wet blanket on that, not by any means, but to be realistic about what we are seeing. And this hour we are going to talk about a lot of different approaches here, what is new in this field, what patients are experiencing. But when it comes to this treatment, I'm reading this as a layperson, Dr. Schneider. Understand when the lay public gets our hands on this, we're dangerous because we think, well, this solves everything, or this, and it's not necessarily something that solves everything. But it feels very futuristic, and I want you to take me through what we are seeing with that and who it might apply to first.
Yeah, absolutely. So what Evan is referring to is the new adaptive deep brain stimulation technology that was just recently approved by the FDA, one of 4 new approvals in the past year. So deep brain stimulation, or DBS, has been around for quite some time now. But it's not something that's readily available to everybody with Parkinson's disease. Probably less than 5% of people with Parkinson's disease have DBS, or deep brain stimulation therapy. And what it helps with is to kind of even out the ups and downs in your symptom management when you have Parkinson's disease. It helps to manage tremor, and it can help to improve quality of life. So what's new and different about this approval is that this is adaptive. So what that means is that instead of the physician setting the programming, so selecting how the current is delivered and where, we set it, but then the technology can adapt to brain signals that it senses kind of in real time. So that means that the individual can have more personalized treatment, and they can get the stimulation that they need when they need it based on their activities.
I mean, it sounds so amazing to me. Does this sound just run-of-the-mill to you now in this field?
No, not at all run-of-the-mill, and I didn't mean to be a wet blanket. It's just level setting about the number
Absolutely.
of people who actually have access to this therapy. But it is phenomenal, and I think it's the tip of the iceberg, and there's more to come.
Okay, so how do you know if you're the kind of person who's in this category, a patient who could benefit from this?
So right now, there's essentially 3 different indications for getting DBS in Parkinson's disease. So one of them is that you have a tremor or shaking that does not respond well enough to medication management. The other 2 indications are what we call motor complications. So these are problems that arise when you've been on treatment for your Parkinson's disease for a long time. So we have many medications that help for Parkinson's disease, but unfortunately they are often associated with motor complications, which are dyskinesias, these kind of extra wiggly movements that can be really bothersome and uncomfortable for some, and off time. So this is times when the medication just seems to stop working or it wears off and you don't have as good of a benefit. So if you're having one of those types of complications, you might be a candidate for DBS.
All right, that's a great start here. And listeners, if you've got questions, comments, I want to welcome them all throughout this hour. You can call the program toll-free, 844-295-TALK. It's 844-295-8255. It's 263-WXXI if you call from Rochester, 263-9994. You can email the program, connections@wxxi.org. If you are watching on our YouTube channel, hello there. You can join the YouTube chat, and we'll work in some of your questions, comments as we go here. Before we kind of get into how everyone is doing here, I always want to know how Yvonne's doing. We'll talk to Amy about her story. But I mentioned the Rochester Parkinson Network, and I think it's valuable to mention there's an expo coming up, and people who are not familiar, Yvonne and Kevin, you want to tell us a little bit about what the Rochester Parkinson Network is?
Sure. Rochester Parkinson Network is dedicated to making sure that every person that's affected by Parkinson's disease is connected to the information, resources, and allies they need to thrive. So we focus on education events, providing information through a fantastic website, and this expo that you just mentioned that's coming up April 26th at the JCC in Rochester will have almost 40 exhibitors with information about living transitions, for example, food options to simplify cooking chores, pharmaceutical companies, assistive device companies, boxing, exercise, ping pong, PT, OT. So all sorts of services like that and organizations like that that are beneficial for folks with Parkinson's disease. It's open to everyone and it's free. Again, April 26th from 10 a.m. to 4 p.m. at the JCC.
When you hold events like this, I'm sure there's people probably learning for the first time about all kinds of things related to Parkinson's. What kind of community has developed out of this network?
Well, we've existed now only for 3 years. Mid-April will be our 3-year anniversary. And in that period of time, we've come a very long way. We are serving roughly about 1,000 people in the greater Rochester area right now, plus a number of people, of course, electronically through our website and whatnot. But if you consider the fact that there are somewhere between 4,000 and 5,000 people in Rochester that have already been diagnosed with Parkinson's disease, and another 4 for each one of those people that is directly affected, you're talking about 20,000 to 25,000 people in Rochester that are affected by Parkinson's disease. So we're just beginning to hit the tip of the iceberg.
How are you doing, Yvonne?
I'm doing great. Thanks for asking.
Yeah? What's the latest in your life?
Just trying to manage my fall frequency. But that's, I'm hoping that's the result of my DBS battery is starting to lose its charge, I guess, and they're typically last for 3 to 5 years, because my settings are a little bit higher than normal than an average person with DBS. My batteries have not lasted quite as long, so I'm coming up on a battery change, and I'm hoping that's what's caused the falls. But other than that, I think I'm doing great. Now,
when you talk about DBS, again, the danger of a layperson hearing these terms and trying to make sure I understand. When we talk about this new technology versus what you've been using for a while, not exactly the same thing? And I don't know if Dr. Schneider wants to weigh in here too.
DBS has been around for several years. The difference is that Yvonne's DBS just gets set. So there's a setting. She has a little bit of ability, I'm assuming, to adjust it if she needs to. But it is not adapting in real time to brain signals. That's what's cool about the new technology, is that we don't have to play this guessing game of, when do we need to make adjustments, exactly how do we adjust it. The adaptive technology senses brain signals and automatically adjusts the settings in real time.
And the adjustment takes place in the battery portion, so my electrodes would be compatible with the this new technology?
That's a great question, Yvonne. So we are just starting the training at U of R this week. Everybody is super excited about the technology, so more to come. Like I said, I would reach out.
Yeah, we'll do.
And so, but you've got it coming up here, your renewal of the battery. Are you going to miss a deadline here? How's this going to work out for you?
Oh, well, what will happen is I'll go in for, it's an outpatient surgery, and my battery will be replaced with but this time I'll get a rechargeable battery. So this one should last for 10 to 15 years. And depending upon whether this technology is compatible with the electrodes that are implanted in my brain, then I will be able to take advantage of the adaptive quality of it.
It's an outpatient procedure? Is that what I heard? Is that right?
Oh, the battery replacement.
The battery replacement is.
DBS is not.
I would not think so, right? We're talking about the brain.
Yeah.
Okay.
Yeah, that was cool. That was really cool.
That was cool?
Yeah, it was.
The brain surgery?
Yeah, it was. It was very cool.
Explain.
Well, when I did it's advanced so much from when I had it in 2013, and at that time they did each side separately, so it was 2 different surgeries, and you're awake for it, and the fact that you can hear the drill going through your skull is pretty amazing. You have to.
You think that's cool?
Yeah, it's very cool. It's very cool, and they just all that you're awake for, and all that you're able to experience and see what's going on. It's just incredible. It's really amazing. So the drill automatically stops so it doesn't do any damage, and the electrodes are placed. They place both electrodes in one surgery now, so that's cut down drastically on the amount of time that people have to spend at the hospital. But you have to be awake so that they can ensure that the electrode is in the right spot, part of the brain, and they do that by, I'm not exactly sure. Ruth, maybe you can help me here.
Yeah, absolutely. So the placement of the leads is very important, right? And so our team at the University of Rochester, which is run by Dr. Andy Wenzel, our neurosurgeon, and Dr. Carla Lizarraga, our neuromodulation expert, they work very hard in the operating room to make sure that these leads get exactly in the location where they need to be. And they do that partially through taking some images in advance to help them plan. But then also they take some recordings during the surgery, and they will have the individual do some different things while they're in there, and that way they can sense some of the brain signals and tell if they're in the right spot or not.
Remarkable.
Yeah, it's really cool.
You are amazing. Watching your husband react to that story was something else. Yvonne, when I was maybe 18 years old, I had a 7-minute surgery to take a little cyst out of right between my eyes. I was born with it. I thought everybody had it. It felt like a third eyeball in there. I could move it around. And when I realized other people didn't have it, I inquired about it and then found out we should probably take this out. The 18-year-old me was terrified. I begged to be sedated for a 7-minute procedure. And they said, we can't sedate you for this. We cannot. They were not drilling through my skull. You're an amazing person. And I do hope, though, that over time, that has provided the quality of life, at least maintaining quality of life. How much difference do you think it has made for you?
I think it's made a huge amount of difference. I attribute it in large part to the reason I'm doing as well as I'm doing. 2007 is I think I've had Parkinson's a fairly long time, and I think I'm doing really well, relative to what you expect. What one might expect from Parkinson's. I was diagnosed younger, but I think all in all, I'm doing well. I qualified for DBS because I had a lot of dyskinesia, and I was taking a lot of medication, and since the DBS, I sleep better. My medication is leveled off. I don't take as much as I was taking at the time of the surgery, and my progression has been very, very slow. So it's really afforded me an opportunity to live a great life.
Kevin, can you weigh in on that too? I mean, whenever you get a diagnosis, you probably spend a lot of time doing quick research and trying to figure out what that means. And part of what Yvonne is saying there is, if you would have asked her in 2007, 2008, 2009, what do you expect your life to look like in 2025? It might not have been as optimistic a picture as the reality is, and that is a good thing. Did you experience the same thing where you're looking ahead saying, this is probably when the things will change, and has it been a better curve than you expected?
A much better curve than I expected. I was very worried about what was going to happen to her, and as a result, to our lives together.
Sure.
And certainly early on, there wasn't an awful lot, certainly not as much as was known then as there is now about Parkinson's disease, about the causes, about the trajectory of the disease for a lot of people. Younger people, as Yvonne was diagnosed when she was 44, younger people do generally tend to progress more slowly. I certainly didn't know that at the time, nor did she. And like most people, even still today, people who get a diagnosis of Parkinson's disease are told, I'm sorry to tell you this, you have Parkinson's disease, come back in 6 months. And many times they walk out of the doctor's office not having a clue about what to do, where to go, where to get information. That's another place where Rochester Parkinson Network is helping people. We've developed a package that we've managed to get to the University of Rochester and to Rochester Regional Health and to Rochester Neurology Associates so far. We hope to deliver it much further throughout the neurology network in the greater Rochester area. And this package gives people something they can walk away with and a place to start to find the milestones on their path to help them live the best life they can.
Well, let me ask Dr. Schneider about that. Dr. Ruth Schneider, when it comes to how the medical system is interacting with patients, is it improving from what Kevin has talked about, some of that we'll see you in 6 months uncertainty? Is it better communication that you are seeing now?
I think in some ways it has improved, thanks in no small part to the advocacy efforts of the Hyltons and the Rochester Parkinson's Network. In some ways, there are just system issues, right? So you open the show by talking about how the prevalence of Parkinson's disease is growing, and there are probably 4,000 people in Monroe County alone who have the disease. And so there are bandwidth issues. We have to make sure that we have neurologists here to take care of folks with Parkinson's disease and that they can get into clinics and get in when they need to be seen.
Well, let me turn to Amy Jones for your story, Amy, and I want to give you some space to tell us a little bit about your own diagnosis and what life has been like for you.
Okay. Yes, there are two lives you have when you're a Parkinson patient. You have life before Parkinson's, before diagnosis, and then you have your life after, because it is definitely a shock to the system. For myself, I found out about 5.5 years ago that I had it. So I was just 62, looking to retire, planning on that. I was a librarian at one of the correctional facilities and ran the inmate library, and I'd been doing that for 16 years down at Livingston. And then along came this diagnosis, which I found out about it because I was having trouble with my shoulder. I had surgery on it for a worn rotator cuff and long terms, but anyway, I had that surgery done. It'd been a year, but it wasn't healing right. I still had pain, and I shouldn't have, according to the literature and according to the surgeon. So he, not knowing what else to do, just for something to placate me, I think, sent me for a nerve conduction study. And that was at the U of Rochester. I went in and had that done. And he just almost immediately, before he even started, he said, "This is not the right test for you." But he goes, "We'll do it anyway, just to satisfy them." So he did. And then when he was done, he goes, "Well, I'm going to go make some notes, write some things up, and I'll be back in to talk to you." And my husband was with me. And as he closed that door, it just came over me that my life was about to change.
He hadn't said Parkinson's yet?
No.
Okay.
He hadn't said the word.
Mm-hmm. Was that on your mind?
Not until then.
Okay.
But then what it did was it triggered a memory of having my father at the doctor.
Oh, boy.
And finding out that he had Parkinson's. And yeah. In fact, that was the same place, even though my parents didn't live in Rochester, they were over in Rome, New York. The neurologist there had recommended a second opinion when he had diagnosed Dad. So he sent us out here to Rochester, the U of R. And they gave Dad a thorough assessment in that, and that's where he got his diagnosis.
So that goes through your mind, and then does the doctor come back in the door and essentially say exactly what you were thinking?
Somewhat, yeah, somewhat. And he was nice enough, but all he was able to do for me was he goes, "I'm going to refer you to a colleague. It'll probably take you a month." He thought it'd take a couple months to get in. It took me just a month. I found out I was very lucky there. But that was it. That was it. That was all I walked out the door with. And George and I were just stunned. I mean, more than stunned. And who do you turn to, you know? So we turned to each other. And I had gone through over a 10-year period of progressively long-distance care from my parents and my father. He was 87 when he died, and he'd struggled for about 10 years with the Parkinson's. Spent the last 2 years of his life in a nursing home, and the last 2 months in a wheelchair in the nursing home because he fell and he broke his hip. And I think when the end finally came, it was a blessing for him. So, I had all that under my belt, which had just ended maybe 5 years prior or so to that. So this was going to be retirement. And this was not the retirement package I had picked out, and I couldn't find the department to go to send it back. So, play the cards you're dealt. And I was fortunate when I did my undergraduate work. I was at SUNY Institute of Technology over at Utica, Rome. And I had a wonderful professor named Dr. Joanne Joseph. And she taught a health psychology class, and she focused on teaching people the value of resiliency and how you can, for not only yourself, but for your children and anybody else as well, learn how to develop hardiness within yourself to deal with life 101. And it became, I had used it throughout my life, but it became really a game changer for me because now I held on to it for dear life. This was going to be hard. This was going to be very hard. And you have to learn you are the locus of control. You can't control necessarily what happens to you, but you can control how you respond to it. And that's where the value is. So I determined to do just that. So I dived in, fortunately, having a background in library science. I love literature and I love looking stuff up, so that was good, right up my alley. I researched, and that's how I came up with the name of the support group. And that's how I met these two wonderful people, Yvonne and Kevin, as well as some other wonderful people in the support rooms. I settled into going to mainly the one in Rochester, the central one, because it was just easier and it was at a convenient time. But that's a women's only group. But they're great there. So I found that. I found other things. I found it turned out that the doctor that Dr. Stanton had referred me to was just excellent. So I had no problem staying with him, Dr. Peter Morrison. And I've had good luck there. I started off on low doses of medication, the carbidopa, levodopa, the usual standard. And my progression was slow. And I guess it still is slow, but it's interfering more with my life now.
How so?
Well, let's travel. I have up times and down times. Pills don't last as long. I take pills 6 times a day, and every one of those 6 times includes the carbidopa, levodopa medication, as well as other things, something for sleep, gabapentin for nerve pain, some other extenders to help the Parkinson's medication, the carbidopa levo work, and then there's all the good stuff, the Colace, the stool softener, all the unmentionables, but it affects all your systems. So yeah, there might be a day just devoted to, okay, folks, it's time to get stuff moving along here. And it's a day for the gut and for taking care of it. And yeah.
But you said it's a slow progression relatively.
Yes.
Okay.
Yes. I mean, I've heard of people going from 0 to 60 and gone in 2 years or whatever. But it depends on how well you take care of yourself. I am not the poster child for physical education or activity.
And they probably tell you that will help.
It will. Oh, yes. That is, and it does. But I need to hear it, so I keep trying. I've been lucky to be able to take several classes over at the JCC and other places. Dabbled in the Tai Chi and the yoga and some other classes. But one of the most recent side effects or things that reared its ugly head was leg cramps, foot cramps. Oh, excruciating. They just came out of nowhere, out of the blue. And yes, just your toes will curl, everything. And now I've gotten good enough that I can actually walk on them. Because I said, I'm getting my coffee, and I'm not waiting until you're ready to get out of bed. Conversation with toes. So there they are, curled underneath me, and I'm hobbling out to the kitchen, but I make it, and I get my coffee, I sit down, and they finally put themselves to bed and let me go on with my day.
Amy, can I also just ask you a little bit about some of what I read about your story, what it's like being one of 3 people who grew up on a rural dirt road with Parkinson's disease?
Yes. It was a bit of a shocker. Myself, my father, and a neighbor, just a stone's throw from my parents' house. I mean, I could literally in my good days, I could hit their kitchen window.
And do you put your inspector's hat on and start asking, what's the connection here?
If I lived in Rome still, you better believe I would have done that in a heartbeat. Mm-hmm. Yes. Dirt roads, not a quarter of a mile, maybe. It's not a long one, and 15 houses maybe on it.
But you don't have something in your mind that explains that, if there is a connection?
Well, my hypothesis would be, and what I would want to determine is test the soil and the water, because the area in front of my parents' house was all farmland before people bought up this land from the local man. It was in his family and his farm, so he divided it into lots. My parent bought one way back, and everything in front didn't get sold. He saves it, and the local farmer farms it. But on the other side of the road, yes, there are 1, 2, 3, 4, 5, 6 houses, I think, yes. So yeah, not even but 12 houses, and most of my brothers, no less. So I would want to know what the soil and water samples showed, because everybody was on well water, or that. There was no city water. So I'd want the water and the soil tested, because there is a lot of literature out there that connects pesticides, paraquat, other pesticides and farm materials that they use for crops, crop protection, etc. There are a lot of them connected, showing a connection between their use and Parkinson's. And I mean that in no way to blame the farmers. No,
Sure.
I came from farm stock myself. We were talking about farming out in the hall there. And I have relatives up in Watertown, that area. I was doing genealogy on the Barnes Corners area up in New York State. And yet they were all farmers. So, yeah, I have nothing but respect for farmers.
I'm always very sensitive to making sure we're talking about the best information we can. Maybe I'm especially sensitive because last night I watched Jubilee Media has a system in which they put one person surrounded by 16 to 20 people who might disagree with them or challenge their ideas. And last night it was Dr. Mike talking about vaccines with vaccine skeptics. And some of the things that the people were saying to the doctor, I'm going, oh my goodness, like where are we getting information from? And it's a lot to fact check. And so I just want to ask Dr. Schneider, you hear Amy's story, and there's a lot of people who very justifiably want some answers on where things have come from. And how good is the data that you've seen now about understanding some of these either environmental causes, chemical causes, et cetera?
Yeah, I think the data is very strong. So generally speaking, there are a small proportion of cases of Parkinson's disease that are caused purely by environmental exposures like toxins. There are maybe 10% to 15% of people who have genetic forms of Parkinson's disease. And then everything else falls somewhere in the middle. And it reflects an interplay between your genetics, right, what your genetic makeup is, and your environmental exposures. And that includes things like well water. It includes pesticides. It includes occupational solvents like trichloroethylene or TCE. I think the evidence is great. I mean, the EPA just banned TCE last year. Is that right, Kevin? And hopefully it gets enacted this year. Fingers crossed.
Yeah, I'm a little worried about that.
Okay. Well, listen, we are late for our only break of the hour. And what we're going to do when we come back from this break is I want to ask Dr. Schneider about what else the FDA has approved in the last year. We've talked about some of that, but the state of the landscape of treatment and approach to Parkinson's disease. You just heard Amy Jones's story. Yvonne and Kevin Hylton are here from the Rochester Parkinson Network, and a lot more to discuss. We'll get some of your questions as well on the other side of this, our only break of the hour.
Support for your public radio station comes from our members and from Mary Cariola Center, providing education and life skills solutions designed to empower individuals and the families of those with complex disabilities. Mary Cariola Center, transforming lives of people with disabilities. More at marycariola.org.
This is Connections. I'm Evan Dawson. Did I miss anything you want to add there, Amy? I know in our conversation you had mentioned a lot about Parkinson's. Anything that you want to make sure people hear? You've got some documents there.
Oh, I've just got a couple of headlines I'll read to you.
Sure.
This was papers that I printed out a few years. This is 2017. And the headline in this paper is Trump administration delays bans of toxic solvents. Regulation of high-risk uses of trichloroethylene, methylene chloride, and MP on hold. So, yes, as Kevin said, we're kind of worried in the activist corners that anything is going to happen now that this administration is back in place.
Okay, Kevin, anything you want to add to that?
Well, the Biden administration did ban trichloroethylene and methylene chloride, and a few other industrial solvents, except for certain limited uses. However, that ban was not enacted, and it appears as though it's entirely possible that the new administration may overturn that ban.
Okay, so that's something for us to follow there. And I guess, Dr. Schneider, I guess administration, you just kind of got to react to what the policies are. Anything to add on what you're seeing from the federal level on that?
Well, I think, Kevin highlighted one aspect that's worrisome. I mean, I think has also been much in the news are the devastating cuts to NIH, CDC, FDA, all these other organizations, and that does play a role in the development of new treatments. So the gold standard treatment for Parkinson's disease is levodopa, and it has been for decades. That foundational research was in part conducted at the National Institutes of Health, the NIH, and the NIH is just so critical to developing new treatments for Parkinson's disease and other diseases, and also training the next generation of scientists. So I think there's a lot happening right now that potentially changes the playing field for Parkinson's disease. But there's also good things happening, right? So we mentioned the 4 FDA approvals. So in the last year, there's been 3 others that we haven't talked about. So one is a new form of levodopa. That's a combination of immediate and long-acting. One is a subcutaneous form of levodopa. So this is like a pump version, if you think about a pump that somebody with diabetes might wear. And then there's another pump version that delivers a different drug called apomorphine. And so it's very exciting to have some new tools, some new medications that we can use to help treat Parkinson's disease. I think we're all still learning how to best use these and how to put them into practice. But I think it is slowly changing the landscape of what's available for Parkinson's.
What is missing from the toolkit most that you want to see come along?
What is most missing is a drug that slows the progression of Parkinson's disease. So that is really what the research field is trying to achieve and has been for many years. There's many different exciting avenues of research. Some are focused on, addressing some of these problems that arise from genetic variants. Some are focused on targeting the abnormal protein that gets phosphorylated in clumps in Parkinson's disease. Others are thinking about repurposing drugs like diabetes drugs, and all trying to come up with ways to slow the progression of the disease and hopefully one day even prevent it. So that's kind of what is most needed in the field of Parkinson's disease. And, I think it's exciting to see the field more actively moving towards prevention trials, right? So thinking about how do we intervene much, much, much earlier in the disease course to potentially prevent the onset of symptoms at any point.
When you mention NIH, for listeners who've been trying to follow along with what cuts may be coming from the federal government, I think there's been a lot of speculation about possible research cuts. You hear all kinds of talk about is cancer research, going to be dramatically scaled back. So Parkinson's, you talk about it, but how inevitable is it? I mean, what do we know is happening, or is some of it just kind of speculation at this point?
I haven't gotten any indication that Parkinson's disease research is particularly being threatened or is at risk, but I think there's a tremendous amount of uncertainty right now from, and certainly evidence that grants that are focused on DEI efforts are being targeted and have been cut. Study sections have been delayed, so the mechanisms, the processes by which the NIH reviews grants and decides what to fund, that whole machinery has been drastically slowed down.
But what would DEI have to do with it?
With Parkinson's or with?
Well, you mentioned that it's being reviewed. How is that possibly related to, what's getting cut or how this is unfolding?
So the two main issues are there was a cease in communications at the NIH, and so this delayed this process of reviewing grants and sending out funding notices to research teams. There's also been some grants that have their funding has been revoked, and these grants have been on the largely on the topic of DEI, right? So understanding, for example, LGBTQ health, topics like that.
Okay. So, Yvonne, when you look at what's going on with some of that, are you worried that what's happening at the federal? You are.
I'm very
I didn't
worried.
even finish the question.
Yeah, I
You're
was
jumping right in.
Pick me.
So, well, tell me what you're concerned about.
I'm concerned that the universities are the research funding is being cut. I'm concerned that NIH is being defunded. The Parkinson's. One more thing I'm worried about is EPA laws being rolled back.
Mm-hmm.
Parkinson's is it's proven that there are chemicals that trigger it, and this country is allowing those chemicals to exist in our environment, to continue use of some of them, and our food system is certainly no poster child for healthy, clean food. We're essentially, this is a bit of an overstatement, but we're essentially poisoning our kids by letting these things stay in the environment and in our food system. Parkinson's takes years to develop and identify it in a person. So, until these environmental issues are addressed, we're going to continue seeing Parkinson's cases, and they're already increasing, as you mentioned at the beginning of the show, astronomically, and it seems like we're moving in the wrong direction from a policy standpoint to control it.
If I can weigh in a bit on that as well. You heard Ruth say earlier that paraquat, for example, is connected with Parkinson's disease, and that's been proven. Paraquat is manufactured in Great Britain and in China, and it's banned in both of those countries for use. They export it just fine to the United States, and we use it. And it's on almost every corn and soybean crop in the United States, except for organics. The industrial solvents that Ruth mentioned, trichloroethylene, perchloroethylene, those have also been shown to be connected with disease, cancers, Parkinson's disease, other neurological conditions. But we still are allowing their use, and someone has to take action, and it has to be the people that are going to take action to change the landscape in our favor.
China banned paraquat in 2017, citing its high toxicity and the potential for pesticide poisoning. So just a little fact check there. Kevin's on the money. No surprise. But can I ask Dr. Schneider, some of what Yvonne is concerned about, some of her fears that she relayed? What would you say about those concerns that she has about
I would say
research?
they are well-founded. I mean, I share Yvonne's concerns about research. Again, the role of the NIH in advancing new treatments and developing new treatments and helping to build the researchers of tomorrow is just so pivotal. It's so incredibly important. And so I definitely share her concern and her frustration. And I would say that we should all be out there advocating to maintain robust levels of NIH funding, just as one example.
Well, and let me read a little bit from March 12th here, Associated Press headline on what the EPA is doing. But before I read this, I mean, I don't want to paint the picture that any deregulation, any single deregulatory action is going to lead to disease or inevitable disaster. There's a new book by Ezra Klein and Derek Thompson called Abundance that is pretty critical of a regulatory regime that makes it very hard to build environmentally friendly projects and low-income housing and things like that. So there's certainly debate about what regulation is necessary. And yet I've mentioned on this program recently that I showed my son recently a picture of, I grew up in Cleveland, of the river in 1979, the year I was born. And he said, "Where's the water?" It's an aerial picture of the Cuyahoga River. And I said, you're looking at it. He said, well, it's orange. And he said, how is anything alive in that water? And I said, it probably wasn't. The river caught on fire in, I think, the 60s or 70s. So I don't...
12 times.
Okay, so again, Kevin's even more on it than I am. So it's easy to find. You should Google that picture, listeners, of the Cuyahoga River. I'm not saying what I'm about to read means we're going right back there, but I think it's worth asking, what are we doing and why? So here's the Associated Press. In what he called the most consequential day of deregulation in American history, the new head of the Environmental Protection Agency announced a series of actions to roll back landmark environmental regulations, including rules on pollution from coal-fired power plants and electric vehicles. Regarding climate change and electric vehicles, he says, we're not going to focus on that. We are just driving a dagger through the heart of climate change religion and ushering in America's golden age, new EPA Administrator Lee Zeldin said in the Wall Street Journal. In all, he said he's rolling back 31 environmental rules, including a scientific finding that has long been the central basis for U.S. action against climate change. That's Lee Zeldin. Obviously, he's from New York State. He ran for governor here. And he says that his main goal with the EPA is to cut regulation. That's his main goal. So I'm not trying to paint like a dark picture. I'm just saying that we're in a bit of a different set of emphasis, and we should be asking what each one of those 31, or whatever the number is, what they're doing and why. Look up 2000, the Martin County, Kentucky coal slurry impoundment spill. 200 miles of waterways, everything dead in the water. So these are the kind of the regulations that are being targeted here. So we'll see. Let me get just a little bit of your feedback here. And there's a question that I think is really important. It comes from a listener who says, I have a dear friend with Parkinson's. He's open about it, but there are general limits. Are there general limits on how proper or comfortable one can be in discussing the disease with people who have Parkinson's? Please don't use my name. He says, he didn't want to tip off his friend, but he just wants to know, are there certain things that, Yvonne, that you don't want to have people to ask about or talk about? I mean, he's trying to be a sensitive friend here.
I try to err on the side of give them TMI. I've learned so much about this disease, and I want to share what I've learned, and they're not all. It's not all, polite dinner conversation talk. We talk about stool softeners and bowel movements and incontinency and vision changes and mood changes, apathy. But if we don't talk about them, we don't share our experiences. We don't learn. We don't kind of embrace that the new now, the new me. When you walk with Parkinson's, you shouldn't walk alone. Hearing that other people are sharing those experiences is comforting, and Amy, I would appreciate your thoughts.
What do you
on
think,
that.
Amy?
Yeah, that's fine. I just wanted to jump in and say that when Kevin does a closing or even an opening for one of the network's trainings, etc., he always focuses on describing and reminding the participants that you are the network, he will say, and spread his arms wide over the whole audience, conveying that we are what really make it spark. Because with Parkinson's, everybody has it different. It's like a snowflake disease. You never know what you're suffering with. So sometimes your best place for help is to talk to others, or on the chat lines or the forums, whatever, the various Parkinson's not-for-profit organizations. And they'll have suggestions posted. And a lot of times you'll find something that might work. Or sleep problem, again, regulatory, sleep apnea. You never know. Dystonia, which is what the formal word for the leg and feet cramps is. You never know who you're going to come across that'll have a solution or a thing to try.
So talk about it.
So yes, so talk about it. You can't err, people that have had it, we've heard it, heard it all, heard it all. It's like working in the you're like, a paraprofessional in the medical field. Yeah, you can't embarrass those nurses. They've seen everything.
Well, Amy mentioned Kevin and the Rochester Parkinson Network. Once again, as we get ready to close here, Parkinson's Disease Expo is coming up on April 26th. Kevin, what do you want people to know?
That is correct. April 26th at the JCC from 10 a.m. until 4 p.m. But there is one other thing I would like to say,
Sure.
And this is a scoop right here on WXXI and WRUR radio. Today, this morning at 9 a.m., Rochester Parkinson Network announced that there is a respite care grant program which is now available through Rochester Parkinson Network. It will allow up to 12 hours of respite care for anyone who applies for and is made a recipient of that grant. We're doing one per month for this year. Once we get all the bugs out of that program, we hope to do more. But that is available as of today. You can go to our website, RocParkNet, that is ROCPARKNET, .org, and get more information.
We'll put a link in our show notes to the Rochester Parkinson Network if you want to learn more, to get in touch, as Amy did, and it certainly changed Amy's life.
Oh, absolutely. These two are fantastic.
We tend to think so. We love having the Hyltons back here. Kevin and Yvonne, thank you for sharing your story and doing the work. We appreciate having you back on the program.
Thanks for having us.
Amy Jones, great to meet you. Thank you for telling your story. Good luck to you.
Thank you.
And for all the expertise, thank you, Dr. Ruth Schneider. Thanks for sharing with us today.
Thank you.
From all of us at Connections, thank you for listening. Thank you for watching on the WXXI News YouTube channel. Wherever you are accessing us, we will be back with you tomorrow on member-supported public media.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station, its staff, management, or underwriters. The broadcast is meant for the private use of our audience. Any rebroadcast or use in another medium without expressed written consent of WXXI is strictly prohibited. Connections with Evan Dawson is available as a podcast. Just click on the Connections link at WXXInews.org.